So I know one of the things you spoke about a little bit earlier was some of the different aspects of like definitely like community health,
Right.
and even some of like the different that socioeconomic factors and different things like that, and environmental factors that often affect a lot of people.
Right.
And obviously a lot of those things often affect patient care and healthcare and wellness on a large scale. How do you envision, or maybe what are maybe, I guess, let me ask this. So do you see any sort of challenges to making an improvement when it comes to community health, especially from that angle? And how do you maybe see that improving?
A lot of it's going to be extremely challenging, of course. End of the day, the patient's going to be spending 99% of their time out of the office. It's just the nature of the matter. So the only way we could really make a substantial impact on patient health outcomes is by altering what's going on in the community, right? Now that poses a lot of challenges from many different aspects, from political to social to cultural. You're going to be tackling a lot of different issues all at once, right? And it's not just one-sided. I know oftentimes we just see policy this, policy that. Policy can only go so far, and it's about really reaching into the hearts of the people and altering what they believe, right, in order for their own benefit. And that's controversial, it's difficult, and it's going to be rife with challenges, right? So let's take a situation, let's talk about food, right? As we know, last century we exchanged viral and pathogenic causes of death, right, to more chronic illnesses. Right? So when people were dying from bacterial illnesses 100 years ago, that's a lot less common, but it's more common to die from diabetes or coronary heart disease, et cetera, et cetera.
Yeah.
Food is at the center of that. And at least is one of the major factors.
Yeah.
Let's take one in my community, for example. It's a food desert. It's not a supermarket for about a mile radius, 2-mile radius. It's very far and few in between. Even if we made policy in which we increase the number of supermarkets and we reduce the cost, how many people are going to utilize it? And even if they utilize it, how do they know what to cook and what not to cook, what to eat and what to avoid, right? So just there in that short example, we had a policy issue, which will take decades, in my opinion, to really rectify, right? You have a cultural issue in which people don't know how to cook with that food. For example, when we recommend eating a Mediterranean diet, how many people are from the Mediterranean know how to cook that specific diet or make it palatable, right? How many people are more likely to stay to their own people's diet, right? America is a cosmopolitan society. You're having people come from all walks of life, all different cultures.
Yeah.
They're going to stick to their own food. I personally like my curry and my rice. And it's horrible for your blood sugar. But how difficult would it be to alter a patient from that diet? And then finally, it's also about education.
Yeah.
We really don't know how to manage patient education, quite frankly.
Yeah.
Right? Think about it like this. You go to a doctor's office. Your average American is having, I believe it's third grade level reading level, right? Let's say third, fourth grade. So elementary school, right?
Yeah.
How are you going to explain hemoglobin A1C to them? How are you going to explain hypertension?
Yeah.
Oh, you're sick, but you feel fine. How do I, but I feel fine. Well, how am I sick? Why do I need to take medication? How do you answer these questions? And even if you're able to answer them, how do you tell them, hey, even though rice doesn't have sugar in it, it still has a lot of sugar, So it's like there's so many, all these questions and all these different factors contributing to the bigger issue. Making a change in the community, it's a long endeavor.
Yeah.
Right? It requires us to build rapport, to be in the communities. You can't be outside trying to fix the problem inside. You have to be inside.
Yeah. No, that's definitely really that's a lot of interesting stuff right there for sure. Because I think what that shows is like it's a very holistic sort of approach, or it's a very holistic sort of issue that's not necessarily a sort of easily clean cut, one size fits all sort of thing all the time. But that, like, I guess if I'm getting at what you're getting at correctly, that there's a lot of different aspects that have to be considered on. You're not only the policy aspect, but you're also talking the patient education aspect. You're also talking about how to actually because you can't, I guess, only like you said, like you can't just try to fix issues in a community just from the outside perspective, but like you actually got to be willing to work with a particular community and help the specific concerns that a community is going to have there.
Precisely. Look, end of the day, we all sit in these comfy college classrooms with the AC blasting, coffee in hand, and we act like we can solve the entire world's problem. In order to really understand the problem, you have to be in the thick of it. You got to get your hands dirty. If you want to help these communities, work in the communities. Do you think these doctors in the big hospitals really help the community? Is it really the local physicians who open up a clinic and are willing to see their patients for 20 minutes, half an hour, to really get to know them that are making the difference? Yeah, of course it's nice, being able to sit back and just comment on the issue without really tackling it. But if you really want to embody what we speak about, what we say, right, then you're going to have to get in there and get dirty, and that's inevitable.
Yeah. So what are maybe some of like the practical ways you could see that aspect of the issue, being solved or seeing more improvement in that area?
For sure. I mean, like right now, majority of us can't do anything, right?
Yeah.
That's just given. Look at us. We're 20 some odd year olds. We don't have an income. We're still learning. We're still in school. Bide your time. You don't need to attack at every single moment. Sometimes it's good to be on the defense. At least sit back a little bit. For now, focus on what you're doing. Keep your goals in mind. Do not let yourself get lost in everything that's going on. It's easy to get lost in medicine, right? Your goals could switch. Maybe you want to have that nice life. It's very tempting, extremely tempting, right? And finally, go out there and spend some time with the community. Don't stay home all the time. Yeah, it's nice having alone time. Yeah, it's nice just being home studying. But like we said, manage your time. And if you do manage your time efficiently, spend an hour or two. Go help out the community. Maybe go tutor some kids for free. Maybe go to a food pantry. Do whatever you need to do, but get to know your community. Because that's the only way you could solve a problem. First, we got to identify the problem. And how are you going to identify it if you're never really there?
Yeah. No, that's good. That's good. Because I think what that kind of keeps coming back to is it's going to be difficult to solve a problem if no one's actually going to be there to really be in the thick of it and make change there.
Exactly.
So, yeah. No, that's
I would
good.
even go so far to say you can't make change if you're not in the thick of it. It's not just about having a few people there. It requires everyone to really be all hands on deck.
Yeah.